It is common to feel a sharp ache right at the tip of your finger at the joint nearest to your fingernail. The stiffness is usually worst when you first wake up, but it tends to ease as you move your hand around. This wear and tear happens at the distal interphalangeal joint, which is simply the small hinge at the very end of your finger. Over time, the bones inside may rub together, making everyday tasks feel increasingly difficult. You might notice that the joint becomes swollen or occasionally locks during simple movements. Gripping objects or performing fine tasks can feel surprisingly tricky when the area is inflamed. Some individuals describe a strange sensation where the joint feels unstable or floats, even if there is little visible change. It is important to remember that medical scans do not always match how much pain you actually feel. Your care team will focus on your specific symptoms, rather than relying solely on imaging results. Inside the joint, a smooth coating normally acts like a cushion to let the bones glide past each other. When wear and tear arthritis develops, this protective layer gradually wears away. The bones then begin to rub directly against one another, which causes the grinding and stiffness you experience. The joint may slowly pull out of place, so the tip of the finger looks bent to the side. Initial management usually involves working with a hand therapist and using a splint to reduce pain. Keeping the joint still does reduce overall grip strength, with the effect becoming more noticeable from the index finger down to the little finger. These conservative methods should be given time to work before considering further steps. If symptoms persist, your surgeon may discuss medical options or injections to ease pain. When conservative care reaches its limit, surgery can be considered to relieve pain, which usually improves your function. You should book an appointment with your general practitioner if persistent pain does not improve with rest or if the finger feels weak. Ask for a specialist review when the joint hurts or begins to interfere with your sleep or daily work.